doing the language of anatomy video assignments, and the first thing I would like to do is to point out some of the body regions using the skeleton, and I'll try to also use my own body using anatomical terms. So the first that I would like to point out would be the occipital, which is the back of the head. This is buccal, which I put on here, but it actually represents the cheek. Here I have the pointed out here that this is oral, or around the mouth. This would represent mental, or the chin. This here actually represents the acromial, or the point of the shoulder. This here represents the axillary, or the armpit actually. This here represents the brachial, which is the upper arm. Back here I have the directional of the posterior elbow. And this here I have is the antebrachial, the lower arm. This is the pollex, or the thumb. This represents femoral, or the thigh. This here represents patellar, or the anterior knee. But back here I have the posterior knee, which is the popliteal. Then here I have the sural, which is the calf. And then here I have curl, which represents the leg. Then here again I have the calcaneal, which represents the heel. And then I also have here the pollex, which is the big toe. The next part I would like to do is the directional terms. And the first one is the head is superior to the sternum, since it's above the sternum. And the olecranon is distal to the acromion, which is more away from the joint. And the axilla is proximal to the brachium, since it's closer to the midline of the joint. The nose is medial to the eyes, since it's down the midline and between the eyes. The elbow is proximal to the carpus, since it's closer to the joint and closer to the midline. The sternum is anterior. The sternum is anterior to the vertebral column, since the sternum is more towards the front of the body and the vertebral column towards the back. The umbilicus, which would be around the umbilical cord or navel area, is inferior, would be inferior to the sternum, since it's lower than the sternum. The patella is proximal to the tarsus, so it's closer to the joint and closer to the midline of the body. And the ears are lateral, to the nose, since it's more away from the nose. And the next part that I would want to demonstrate would be the 9 abdominopelvic regions. The first region here would be the right hypochondriac, which would have the liver and the gallbladder. This region here is the right lumbar, which has the ascending colon and small intestine. This region here is the right iliac, which has the appendix and the cecum. This region here has the epigastric and has the stomach and the duodenum. This region here is the umbilical, and it has the transverse colon as well as the small intestine. And this region here is the hypogastric, which has the urinary bladder and small intestine. This region here is the left hypochondriac, and it has the pancreas and the spleen. This region here is the left lumbar, and it has the descending colon and small intestine. And then this region here is the left iliac, which has the sigmoid colon and the small intestine as well. So that pretty much wraps up my demonstration for the day.